This is a quick review about assessment of altered mental status patients. There can be many causes of altered mental status in our patients. One common memory aid that's used is AEIOU TIPS. Each letter in this memory aid can have multiple meanings. In addition, there can be more than one cause of altered mental status. For example, alcohol is frequently involved in many of our patients, and it may be the sole cause of altered mental status, or it may be involved but not the primary cause. The key thing we must always remember is that we must treat our patient, manage their ABCs, while we investigate the cause of their altered mental status. So as we start through AEIOU TIPS, we start with A, and alcohol comes to mind right away. Certainly alcohol is involved in many of our patients, but again, just because a patient has alcohol in their breath doesn't mean that they are just drunk. The E stands for epilepsy. This is to remind you of seizures. But remember, not all seizures are caused by epilepsy. Seizures have many causes, in fact. Most of the AEIOU TIPS can also cause seizures. A patient who has had a seizure but is not actively seizing will appear with an altered mental status in what's called a post-ictal state. The I stands for insulin. We use this to remind you of blood sugar issues. A patient with low blood sugar, hypoglycemia, or high blood sugar, hyperglycemia, can have an altered mental status. And much like with the E for epilepsy, remember that not all blood sugar issues are related to diabetes. All of us can have hypoglycemia, whether or not we're diabetics. The O in AEIOU TIPS stands for overdose, or a poisoning. Some people also like to remember O for oxygen, which is a reminder that any hypoxic patient can also have an altered mental status. But typically we think of O for overdose. And overdose can be on a prescription medicine that was prescribed for the patient. It can be on a non-prescription medication or a street drug, and that's where the poisoning fits in here. The U in this memory aid stands for underdose, and that's to remind you that patients who don't take their prescribed medications can certainly exhibit altered mental status. An example would be a patient who didn't take his seizure medication and then had a seizure, or a patient who doesn't take their antidepressants or antipsychotic medications, and then they end up with an altered mental status. So U reminds you of underdose. The T in AEIOU TIPS stands for trauma, typically, which is to remind you that patients that are shocky or hypoxic or have head trauma can have an altered mental status. If you remember, altered mental status is one of the first signs of hypoxia or shock, and also one of the hardest to determine. Some people also like to remember toxins here, as in poisons or alcohol or street drugs. This kind of fits in with the paramedic level memory aid for causes of cardiac arrest, and the H's and T's, and so T for toxins fits in here, particularly for paramedics. The second I in AEIOU TIPS, TIPS, so the second I is to remind you of infection, and it's important to remember that patients who are septic, who have a systemic infection, a pneumonia, a severe urinary tract infection, a pneumocystis, or some other severe systemic infection, can certainly have altered mental status, particularly in our elderly patients. Many of them have chronic infections, whether pulmonary or urinary tract, and altered mental status is one of the key signs there. And the P stands for psychiatric problems, behavioral, emotional situations where the patient either has an underlying psychiatric disorder or is temporarily lost control of their ability to behave and has an altered mental status from that. And then the final, S in TIPS, can stand for stroke or for seizure or for sepsis. We'd kind of already used seizure in the E for epilepsy. We'd already talked about sepsis in the I for infection. And so this one typically stands for stroke. And stroke is certainly a cause of altered mental status and an important one for us to note. So in conclusion, the memory aid for altered mental status that most of us use is AEIOU TIPS, TIPS. And this helps us remember the various causes of altered mental status, but the most important thing here is that we don't become distracted by efforts to play detective and determine the cause, and forget to manage the airway, breathing, and circulation. We should investigate the cause. We should try to determine the underlying cause of their altered mental status, but we must, at the same time, continue to manage the patient, airway, breathing, circulation during our investigation.